Welcome to Carolina's Breast Friends YouTube channel. We are so excited for this session tonight. My name is Carrie Williams. I am the Director of Programs and Volunteers. And tonight we have Natera with us, and we're really looking forward to this session. They will be talking with us about the new product that will help to answer some questions related to understanding our tumors and if we can identify early detection of recurrence. So we'll start with Natera's team, and Major, I'll pass it over to you. Thanks for being with us tonight.
Thank you, Carrie. I want to thank everyone for joining tonight. And I'm just going to do a quick introduction of those who will be speaking to you from the Natera team. So first, I'm Major Griffey. I'm your local clinical oncology specialist for North and South Carolina. Here I have my partner, Anna Canali, and she's the associate clinical oncology specialist. She's my right hand, so she's my partner, covers everything I have. Angela Devine, who will also be speaking to you from a patient standpoint. She also is a clinical oncology specialist in the Tampa, Florida area, and a 3-time cancer survivor. So the stars of the show, Brittany and Carrie. Brittany is a women's healthcare nurse practitioner. Most recently, she worked in gynecologic oncology at a large academic institution in North Carolina. And so she now works with us as a medical science liaison for our gynecologic malignancies. So thank you for coming, Brittany. And then Carrie Flippen, who's our other MSL. Carrie's an oncology pharmacist who worked with breast cancer patients at an outreach clinic for over a decade prior to joining Natera. She is currently working as our breast oncology medical science liaison for the Southeast region. So I will let you take it away, Brittany.
All right, so I'm gonna go ahead and share my screen. All right, and everybody can see my screen, full screen now? Okay, great. So again, thank you guys so much for having us on the call tonight and for this opportunity. I personally am super excited to introduce you guys to this innovative technology that I feel is practice changing. I'm hopeful that our presentation, with our presentation, that you'll have a better understanding of what Signitera is and how it can make a difference in your cancer care. So during our presentation tonight, we'll introduce you to Natera and just discuss briefly who we are as a company. Then we're going to talk about what ctDNA, or circulating tumor DNA, is. We'll discuss our Signitera technology and how it can be used in ovarian and breast cancer. And then you're going to hear from Angela, who is a breast cancer survivor, and she's also currently using Signitera. So she's going to talk to us about how Signitera has personally impacted her cancer journey. And then we'll review how you can get Signitera if you're interested. And then we'll wrap up the presentation at the end with questions. So feel free to drop your questions in the chat throughout the presentation, and Carrie is going to be helping field questions during the presentation, but then we're also going to have that opportunity at the end of the presentation to have an open dialogue and open forum for questions and answers as well. And then just a footnote before we begin, I do just want to note that even though Carrie and I are healthcare professionals, legally we're not allowed to answer any questions related to your health specifically. So we just ask that you keep all of your questions related to our technology, and then direct all of your questions regarding your personal treatment plan to your healthcare provider. So who are we here at Natera? Well, our founder created Natera from a personal desire to change the way disease is managed. And so that culture is embedded in our day-to-day. So our mission here at Natera is personal, and we truly believe that there is a patient behind every test. And so our patients are always at the forefront of our technology and testing, and our patients are the reason, why we're doing what we are doing today. Natera is a global leader in cell-free DNA testing. We're dedicated to oncology, women's health, and organ health. Our aim is to make personalized genetic testing and diagnostics a part of standard of care. And we have over 10 years of experience in genetic testing, and we have well over 4 million tests performed now. And we were founded as a company in 2004, and we launched our very first test in 2009, and that was in the women's health space. And since then, Natera has grown exponentially, and we now offer a variety of genetic tests in reproductive health, oncology, and organ health. And in our oncology division, we offer an umbrella of tests all under one roof across the cancer care continuum. And that includes our hereditary cancer screening test, Empower, and then our molecular residual disease test, Signitera. And for tonight's presentation, we're going to focus on Signitera. So cancer is full of uncertainty. During your cancer journey, you may be asking yourself or your clinician or your loved ones questions like, am I truly cancer-free? Is my cancer coming back, and is my treatment working? Well, molecular residual disease is a powerful tool that can offer peace of mind by answering these types of questions and can help the uncertainty that comes along with cancer become more clear. And many of you may be hearing about molecular residual disease for the first time tonight, and that's because it's a relatively new idea in solid tumors. So let's start off by just talking about what molecular residual disease is. And molecular residual disease, or often referred to as MRD, it's the presence of cancer cells that are left in the body after treatment that are so small and so small that they can't be detected with traditional ways to measure cancer, like imaging. And because of this, molecular residual disease has become a really powerful tool to guide clinical management. And we can detect molecular residual disease through a simple blood draw. And that's looking in your blood for your tumor's DNA, called circulating tumor DNA. So circulating tumor DNA, or ctDNA, are small pieces of DNA from cancerous cells or tumors that are found in your bloodstream. So as your tumor grows or your cancer grows, cells die and they break down, and they release their cellular contents, including their DNA, into your bloodstream. So by looking for your tumor's specific DNA that's circulating in your bloodstream, we can detect the presence or absence of your cancer. ctDNA, or circulating tumor DNA, is in your bloodstream for a very short period, roughly 2 hours before it's cleared from your body. So the presence of ctDNA in your blood lets us know what's going on with your cancer right now. With sensitive tests, ctDNA detection can monitor for the early return of your cancer and track your cancer's response to treatment. So after treatment, whether that be surgery, radiation, chemotherapy, or another type of drug, small amounts of cancer can go undetected by imaging or other standard tests or biomarkers that we usually would use to look for this cancer. And if these cells go left untreated, residual cancer are likely to cause cancer to come back or recur. So imaging like CT, MRI, or PET scans may be used to monitor your cancer. And then you have biomarkers such as CA15-3 or CA125 that may also be used to track your cancer. But these tests have limitations. They can't detect cancer at the molecular level, and they are not as reliable at predicting relapse or monitoring your tumor's activity because they aren't personalized. As ctDNA detects residual cancer in the blood at such a remarkably low level that identifies a recurrence much earlier than we've ever been able to do so before with other biomarkers or imaging. So with ctDNA testing, cancer cells can be picked up more reliably, and you can measure cancer and predict relapse with more certainty than with other modalities. Signitera is our specific non-invasive tumor-informed circulating tumor DNA test that was designed for close monitoring of your cancer. So Signitera can detect cells remaining in your body even after treatment and can discover a cancer recurrence earlier than ever before. You can use Signitera alongside other biomarkers or imaging to improve confidence in your treatment plan and reduce anxiety about uncertain results. And Signitera, it lets you know what's happening with your cancer today and whether or not your treatment is working. So Signitera is a truly personalized test that detects your tumor's DNA in your bloodstream. And we know how unique each person's cancer is, and it's as unique as each individual's fingerprint. And that's how our Signitera test is designed. And no two Signitera tests are the same. So Signitera is completely individualized and personalized to you. And because Signitera is personalized, we can actually design for any solid tumor, and that includes breast and ovarian cancer. So to create your Signitera test, your provider would send us a tube of your blood and a sample of your tumor, either from a biopsy or surgery. And we can use tumor tissue up to 10 years old to create a Signitera test, and it does not have to be from your original surgery. And we look at your tumor tissue, and then your personal tumor mutations are used to create your custom-built Signitera test. So after your test is created, every time your provider wants to take a look and see what your cancer is up to, only a sample of your blood is needed. And typically your provider will order Signitera to be drawn at the same time that your other labs are collected. So you will only need one blood draw. So detecting circulating tumor DNA in the blood is looking like for a needle in a haystack. So it's extremely difficult and hard to find ctDNA fragments because they're very small in size and sometimes slim in quantity. So ctDNA detection really requires an ultra-sensitive test to detect these very small DNA fragments. And our Signitera technology specifically can detect one tumor cell in the background of 10,000 normal cells. So that means that if you have one cancer cell in a tube of blood, Signitera can detect that. And because Signitera is tumor informed and completely personalized to your cancer, the risk of missing a cancer or falsely detecting a cancer that may look like a cancer but isn't is minimized. And Signitera can detect a cancer recurrence months and well before imaging or other biomarkers. In breast cancer, for example, our research has shown that during the surveillance period, Signitera can detect a recurrence up to 8.9 months before imaging and 200 days before CA15-3. And then in ovarian cancer, Signitera has been shown to detect a cancer recurrence during the surveillance period up to 10 months before imaging. Signitera can help inform healthcare decisions throughout the entire cancer journey, from time of diagnosis to treatment of metastatic disease. So Signitera really allows you and your provider to know more sooner. And with Signitera, you can now work more closely with your provider and your care team to improve confidence in decision-making when it comes to your treatment plan. Signitera can be used to help with residual disease detection, early recurrence detection, and treatment response monitoring. So for example, after definitive therapy, like chemotherapy or surgery, Signitera can be used to see if there's any leftover cancer cells in your body, which can help guide next steps in therapy. And then during surveillance, Signitera can be used for early relapse detection. So detecting a cancer recurrence months before imaging or other biomarkers. And then in the metastatic setting, Signitera can be used to more effectively determine whether or not your treatment is really working for you or not. So to sum it up, Signitera is, it's a truly personalized test that detects cancer recurrence early. It's custom built, specific to each tumor's unique signature, and can be used in any solid tumor, and that does include breast and ovarian cancer. It's designed to be used alongside imaging and other biomarkers, and can be used at any time across your cancer journey, from time of diagnosis to treatment of metastatic disease. Signitera can tell you if there's any cancer remaining in your body after initial treatment, whether or not your treatment is working, and if your cancer is recurring. And Signitera can also give you more confidence in your scans. But honestly, most importantly, I think Signitera gives you the opportunity to have a more informed discussion with your care team regarding your treatment journey, and can really help answer any uncertain questions about your cancer. So now I want to pass it over to Angela so you can hear firsthand how Signitera has impacted her journey with breast cancer.
Hi, good evening, everyone. Thanks for having me. I I really appreciate it. You can go to the next slide, Brittany. I'm gonna kind of just start off with like my why. Why I joined the oncology field. I'm currently a COS here in Tampa, Florida, working for Natera and marketing Signitera testing. And this is really my why, is my family, my husband, Scott, my two girls, Alexandra and Samantha, who started this journey with me 9 years ago when they were just 4 and 7 years old. I was diagnosed with ER/PR positive breast cancer. I was a very early stage 1. My only, you can go to the next slide. My only reasons for having a mammogram at the time were because I had an aunt that lives in Australia who had breast cancer, but she was postmenopausal. So really it wasn't like that big of a deal. But I decided to have mammograms at age 35 just to see, because I wanted to know. And, everything was fine. And then at 37, I had a mammogram again and they saw something and called me back. So at that time, that's when I was diagnosed with the ER/PR positive early stage 1. I opted for a double mastectomy and I had chemotherapy and 5 years of tamoxifen, along with Lupron shots. I had genetic testing a few times. I was actually working for a company doing genetic testing. So I actually had genetic testing 3 times. I was for sure thinking I was positive and I wasn't. I was negative. So again, I've always in my mind said, how do I know if this is ever going to come back? What do I do? It's that struggle you face as a cancer patient. You're always worried with every pain you always have, whether, it's in your back. Oh, is that something, so about 3.5 years ago, I found a bump. My armpit was hurting. So I went to my oncologist. She ordered an ultrasound and they saw an area under my skin right above my implant that looked very suspicious. So at that point, I was thrown again into a PET scan machine and tested like crazy. And sure enough, there was a little area that came back underneath my skin. So I went for 18 rounds of radiation and had a lumpectomy and went back on Lupron shots. So everything was fine. But then again, as many of you on this call know, it's kind of the fear you live with every day, not knowing. I've asked my oncologist several times, how do I know if this is ever going to come back? And really the only thing is markers. So I would have my markers done very frequently, every 3 months, and they were always fine. Last summer, in July, I decided to ask my oncologist. I said, hey, I'm working for Natera. I'm selling Signitera testing. I'd like to have Signitera. And she said, no problem, drew my blood. What we need is that pathology report, which Natera will get the pathology, will get the tumor, and we will create an assay for every patient. Unfortunately, mine took a little bit of time to create because I had several surgeries in the 9 years. But I was also presenting to her with some pain in my breast. And it was a very, very, it was like a burning sensation I had. And we did 2 ultrasounds, which came back clear. I had a breast MRI, which came back clear. The only thing with the breast MRI it showed was a rupture in one of my implants. So I'm so sorry, we're having a really bad storm here and I don't know if you even heard that. So I opted to have my implants removed and put back in. And in December, I still didn't have my results from Signitera. Again, reason being was because we were testing several pathology reports. And I was at a dinner program and I felt a bump right on my frontal bone. And I went back to my oncologist and I said, I don't know what this is. She ordered a CT scan. My result from July came back positive for Signitera. So at that point, knowing what I know about the test, I knew I was having a recurrence. I got a call probably a few days after I got that result from my oncologist telling me that the CT scan did come back suspicious. So now I'm, freaking out. I don't know what's happening because the bump is suspicious. So I'm wondering, do I talk to my family about getting my matters in order? What do I do? So I had another Signitera test done. I had my markers done, which again in July were not elevated. And in December, my worst nightmare came true. My markers were elevated. My PET scan showed numerous lesions on several bones and lymph nodes. My doctors acted very quickly, put me on targeted therapy very quickly. I had, you can go to the next slide and I'll show everybody a little bit about how our results look. So as you can see, that first dot that's colored in means positive, and that was from July 20th. At that time, I had the 2 ultrasounds and the breast MRI, and there was no evidence of disease. My markers were normal. In December, as you can see, that spike up. And again, the way we report out is by MTMs. That means mean tumor molecule. So we not only give a positive or negative result, the result, if it's positive, gives you a quantitative value of ctDNA. And in December, as you can see, that spike up, my scan was positive on that lesion on my head. My PET scan showed several bones, my hip, my shoulder, several lymph nodes in my chest area that were affected. So again, my next result is still positive, but it was a sharp decline in ctDNA, and that was with 5 rounds of radiation completed in 2 weeks of targeted therapy. And the targeted therapy that I'm on is Ibrance and fulvestrant. So I get fulvestrant shots every month, and Ibrance is 3 weeks on, 1 week off. I'm happy to say that my last 4 Signiteras have been negative. Knowing what I know about how Signitera works, that those negatives is what allows me to put my head down on my pillow at night and close my eyes and be able to sleep. That's what allows my family to know that, my treatment's working and everything's going to be okay. Because quite honestly, I didn't know what was going to happen when I was told this news in January. But I'm very happy and proud to be a patient of Signitera now. And, where I can kind of speak to this because I am a patient, I just feel that that the markers and the imaging, in a sense almost failed me because those were not showing anything happening, where Signitera in July and that time point were certainly showing that, there was recurrence happening in my body. I just feel that this test really, compared to what else is out there for us cancer survivors and patients, really gives you reassurance to know whether or not the treatment's working, whether or not you are having a recurrence, and, really makes you feel good to see those negative results. So thank you again. Major?
Yep. Brittany, you can advance now. So hang on, let's see. So this is typically what's going to happen. We're going to talk to you about Signitera from a logistic standpoint. So what you can expect once your doctor orders Signitera. So once the test is actually ordered, the patient coordinator from the PC team will call out and discuss Signitera tests and billing with you. And secondly, the provider is either going to choose to manage your blood draw within the clinic, or you will select mobile phlebotomy. So this is the convenience of the test. So we'll touch on mobile phlebotomy in the next slide, but we will actually ship you the kit, and then you will take that kit into your appointment to have your blood drawn. And then we will procure the tissue from there for you. So Once the blood is drawn, the kit is then either shipped to mobile phlebotomy or to you for mobile phlebotomy or for the doctor to do it. And then the kit is shipped in to Natera. And then once we run the test, the results will be provided to your provider. Once those are in, he will bring you back in for that appointment to discuss those results. Here's the convenience of the test. If you cannot, or you live in an area, if you look at this map, nationwide, we have mobile phlebotomists who can come out to your home and actually do the draw for you. So the same process will happen. The kit will be shipped to you. The mobile phlebotomist will reach out to schedule the appointment, and then they will come out and do the draw at your home for your convenience or any location that you select. Here's some of the most frequently asked questions. So again, Brittany covered a lot of this. So how's the test performed? So there is a one-time analysis where we sequence both the tissue and the blood, looking for specific mutations associated with your specific tumor. This is where the personalized portion of the test comes in, because this test is custom built and it's personalized to you. Again, looking at specific variants that are associated just with that particular tumor. Then Signitera detects the presence or absence of tumor DNA, and it is ordered as part of the routine follow-up blood test after the test is initially built. What is the turnaround time? So for that first test is going to be 3 to 4 weeks, because we do have to build the test from the tissue and the blood. So that takes the longest. Then after that, it's a simple blood draw that usually typically takes 7 to 10 days after that for your routine follow-ups. Next slide.
Oh,
Okay, okay.
so I'm Anna. Hi. So some other frequently asked questions. What do my Signitera test results mean? I think Angela's report shows a great example of kind of the different trends and results you can see on a Signitera test. So Signitera positive means that you're at a higher risk for your cancer returning. Signitera negative means that you're more likely to remain cancer-free. Signitera increasing, ctDNA increasing. So as you saw in Angela's, it is a quantitative result. So you actually see the trend. And if it's increasing, that may mean that your treatment, you're not responding to treatment, or your treatment isn't working. And this is just an extra tool that your provider can use to make a more informed treatment decision, along with imaging and other biomarkers. It's just a closer look at exactly what the tumor is doing. And ctDNA decreasing would mean that you are responding to treatment and whatever your providers are doing is working, and you're trending down towards negative, which is a great thing. And so as you saw with Angela's report, Signitera is a serial test. So you will get it throughout your entire cancer journey, or you can get it throughout your entire cancer journey. And you can also get it into your survivorship to monitor for recurrence. So you would like to see ctDNA negative in your survivorship. And yeah, so that's kind of the different results you can get on a Signitera test. Another frequently asked question is, how much does Signitera cost? So we, whether you have commercial insurance or Medicare, Medicaid, we will bill. And if commercial insurance denies, we will appeal on your behalf. And then if they deny again, you will not receive a bill from us. You maybe will receive an explanation of benefits, an EOB, but that is not a bill, and you will not receive a bill from us. And then we do have, for patients who do not have insurance, we do have a cash pay rate, and we do have a financial assistance program that will work with you to get that down to 0 to 150. But again, if you have commercial insurance or Medicare or Medicaid, you will not receive a bill from Natera.
Multiple biopsies.
So another frequently asked question, how do I order? As Major and Angela, Brittany, everyone has mentioned before, you will talk to your provider about this. And like everyone's mentioned, this is a pan-cancer test. So this is for all solid tumor types, but it is dependent on the provider's decision and your different cancer types and situations that you have. So you would just talk to your provider, and they would go ahead and do the blood draw, and we will handle the tissue. So you don't have to do anything with that. And then just come back for your blood draws, and you can get them, like Major said, mobile phlebotomy. We can come out to your house, or you can get them when you're already going to see your provider. They can schedule times for you to come back in, and it's just a simple blood draw. And then you will get the results in the time frame that Major mentioned. The first one takes a little bit longer, since it is we are sequencing the tissue to make it specific just to you. And then from there on out, the blood draw, you will get the results in about 7 to 10 business days. Next slide. So here's your options. Like we said, you can talk to your doctor to discuss if Signitera would be right for you. And then Major and I are local to Charlotte, so we would be there for you guys every step of the way. You can reach out to us. And if your provider has any questions, they can reach out to us. We'd be happy to schedule a meeting with them to go over everything as well. And yeah, we're here for you guys for whatever you need.
All right, so that's all we have for you guys today. I know that was a lot of information all at one time, but would love to take the opportunity now to answer any and all of your questions that you have for myself, Carrie, Major, Anna, or Angela.
Well, I want to thank the Natera team and especially Angela for sharing her story with us, and really looking forward to understanding who is offering this test in Charlotte. And I think that, from all that I heard tonight, it just sounds like a fabulous resource for those that are in treatment and those that are going through survivorship and screening and keeping an eye out for recurrences. So thank you again for your time. We appreciate it. From Carolina Breast Friends, thank you for being with us tonight.